Hello students, good afternoon to all. Today we will start a new topic which is related to uh, cardiovascular system, right? We have already discussed the disorders associated with uh, renal system. Now we'll talk about a cardiovascular system. So the first topic of cardiovascular system or first disease, it is congestive heart failure or congestive cardiac failure, CHF or CCF, right? Now let's understand what is congestive heart failure, right? So let's start with definition of heart failure. It is a complex disorder which can result from any structural or functional cardiac disorder that impairs the ability of ventricles to fill with or eject blood, right? So what happened here, the main problem is the functional or structural disability of left ventricle, right, or ventricles to fill with, means either in a filling of blood or ejection of blood problem, right? They cannot filled up fully or they cannot eject the blood fully. We are talking about ventricles, right? So what it means it describe a condition where the heart muscle is weakened and cannot pump as strongly as before, means the capacity of pump out of heart muscle is weakened or it is less as compared to before, right? Or it also refers to the state in which abnormal circulatory congestion exists as a result of heart failure, congestive heart failure. We are talking about congestive heart failure, means there is abnormality in circulatory, right? Abnormal circulatory congestion which is caused due to the heart failure, right? So now it's clear that congestive heart failure is associated with the disability of ventricles to fill up with blood or ejection of blood, right? Now what are the causes or what are the etiologic factor which is associated with heart failure? So the most common cause of CHF are, it's either coronary artery disease. Now what happen in coronary artery disease? Coronary artery disease means there is a stiffness of blood vessels, wall of blood vessels. There is a stiffness of wall of blood vessels, or maybe there may be the obstruction in between the artery or vein. And then second one is high blood pressure. If someone is suffering from hypertension or high blood pressure, then there may be chances of developing congestive heart failure, right? Then disorders of heart valve like aortic stenosis or aortic regurgitation. These two terms are new, right? Aortic stenosis or aortic regurgitation. I have already mentioned it in your this note. Now, what is aortic stenosis? So here the meaning of this both term or aortic stenosis. It is narrowing of aortic valve which leads to narrowing of exit of blood from left ventricle of heart. Means the aortic valve will maintain the flow of blood from left ventricle, right? Flow of blood from left ventricle. So because of narrowing in this valve, there may be narrowing of the exit of blood, right? So lesser amount of blood will be transferred through the left ventricle, right? And there may be pressure generation on the left ventricle. Then what is aortic regurgitation? So it is leaking of aortic wall of heart which cause blood to flow in reverse direction during ventricular diastole, means the last phase of heartbeat. What happened? There is leaking of aortic wall, right? It is not uh, because of dysfunctional aortic wall. There is leaking, right? And this cause blood to flow in a reverse direction. Reverse direction means from aorta into the left ventricle. Instead of flow of blood which is from left ventricle to aorta, it is flow like aorta into the left ventricle, right? So the flow of blood is reversed. Instead of flow out from left ventricle, it is flow reversed. So these both are the causative agent of congestive heart failure. Then congenital heart defect, right? If someone has by birth, congenital is associated with something which is by birth, right? So there may be birth defect of heart, right? Then severe lung disease, then idiopathic. So these are the main causes of congestive heart failure. Now, less common causes include viral infection or of stiffening of heart muscle. If infection spreads onto the heart muscle, viral infection, right? Then thyroid disorders. If someone has thyroid, then there may be chances of producing CHF. Then disorder of heart rhythm. If someone has problem with heart rhythm, right? Then severe anemia. Plus there are some medications which also cause CHF, right? So these are the NSAIDs. I have already told you that NSAIDs is a class which will reduce the pain, or we can say it is a painkiller. It includes ibuprofen or naproxen. Then anti-diabetic drugs like rosiglitazone or pioglitazone, and anti-cancers. It include cyclophosphamide and 5-fluorouracil. Plus ethanol may produce CHF, right? Alcohol consumption may develop CHF. And these NSAIDs, anti-diabetic and anti-cancer drugs have a ability to produce CHF, right? So these are the causative factors, most common cause and less common cause, right? Now, pathophysiology of CHF. What are the mechanism by which this disease can develop? This is called pathophysiology. So, several pathologic conditions initiate myocardial injury, which can then leads to development of heart failure. So, the disease will start with myocardial injury, right? There may be initial myocardial injury. So, let's start with here it is says that initial myocardial injury is developed due to either pressure overload of heart, pressure overload, that is called hypertension, right? If there is hypertension, then the initial myocardial injury will start. Then second one is volume overload, right? Volume overload. Then volume overload means if there is any defect in valve, then it will produce volume overload. Then loss of function of myocardial tissue. The flexibility of myocardial tissue will reduce. It becomes stiff, right? Due to the coronary artery disease, specifically myocardial infarction. This myocardial infarction is a disease which causes stiffness of blood vessels. Then decrease in this leads to decrease in myocardial contractility, means the cardiac muscle will lose the contractility, right? The flexibility will reduce. This terminology is called as cardiomyopathy. The flexibility of muscle will be lost, right? So what happened, first one is initial myocardial injury. This three are the reason for producing initial myocardial injury, and this will cause decrease in myocardial contractility, means there is a damage in flexibility of cardiac muscle, and this cause systole or diastole dysfunction. Either there may be problem with systole or diastole. What happen in systole, there is a fill up of atrium, right? Both atrium. And in diastole, there is a fill up and ejection of ventricles, right? Then this cause decrease in stroke volume and cardiac output. Now, what is stroke volume? So, it is the amount of blood that is ejected by left ventricle in a 1 minute, right? Amount of blood that is ejected by left ventricle. And what is cardiac output? So, cardiac output is cardiac output is equal to stroke volume into heartbeat, right? Stroke volume into heart rate. So it is almost 4.5 liter to 5 liter per minute. The amount of blood that is ejected by heart in 1 minute, that is called cardiac output. Then this cause activation of compensatory mechanisms. There are three compensatory mechanisms. So let's start with first one, that is activation of sympathetic nervous system. It will cause activation of sympathetic nervous system. Meanwhile, it activate the RAS system, that is renin angiotensin system, right? And third one is cardiac modification. There may be starting of cardiac modifications. So if there is activation of sympathetic nervous system, it will release norepinephrine, right? Then this norepinephrine has effect of tachycardia. Now what is tachycardia? Tachycardia is increase in heart rate, right? Increase in heart rate. Then activation of RAS system will cause aldosterone secretion, right? Renin angiotensin system. Here angiotensin production will cause aldosterone secretion, and aldosterone secretion will leads to sodium and water retention. As we know that aldosterone has antidiuretic effect, so it will retain sodium and water, so it will ultimately increase plasma volume, right? And cardiac modification include increase cardiac force of contraction and heart rate, right? Cardiac contraction and heart rate. So this cause increase cardiac workload, right? It increase cardiac, as there is increase in heart rate, then it will obviously leads to increase in cardiac workload, right? So and it cause cell stretching, right? Here the activation of sympathetic nervous system and RAS system will ultimately cause further stress on myocardium. It will increase stress on myocardium muscle, right? And this cause congestive heart failure. Here cell stretching also cause cardiac hypertrophy, right? Increase in cell size. So it cause cardiac hypertrophy and ventricular dilation. This also ultimately leads to congestive heart failure, right? So it will initially start with myocardial injury and loss of myocardial contractility, activation of compensatory mechanisms, which include activation of sympathetic nervous system, activation of RAS system, and this all leads to increase further stress on myocardium, and this cause congestive heart failure, right? So hope you understand these pathophysiology of congestive heart failure. Now let's move on to the clinical manifestations or sign and symptoms. We can also called clinical manifestations as sign and symptoms, right? Uh, what are these signs which indicates the congestive heart failure, presence of congestive heart failure? So it include irregular heartbeat is not proper. It may be either increased or decreased. If the heartbeat is increased, then this condition is called as tachycardia. And if the heartbeat is decreased, then this condition is called as bradycardia. Right? Then another is shortness of breath. Shortness of breath. This include dyspnea. This is also called as dyspnea, right? Shortness of breath. This shortness of breath occurs while at rest, right? While at rest, when you are in a resting condition. Then during strenuous activity or exercise, maybe during exercise or while lying flat. When you are lying down flat, this condition is called as orthopnea. When your posture is flat, right? You are not lied on a side, any side. This condition is called as during the lying down flat, there is a shortness of breathing. This condition is called as orthopnea. Then at night, which waken up patient from sleep. It also problems during sleep, right? During night, the person have to waken up during their sleep. This condition is called as paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea, right? So there may be problem at night. At night means what? During the sleep, the person may have to waken up because of breathing difficulty, right? Due to fluid accumulation in lungs. These all are occurs because of fluid accumulation in lungs, right? This shortness of breath is due to the fluid accumulation in lungs. Then another one is kinestalks breathing. Kinestalks breathing. This is also called as periodic respiration. Periodic respiration. It is characterized by decreased sensitivity of respiratory center to arterial PCO2, resulting in periodic hyperventilation, right? So there is periodic respiration. What happen here? There is decreased sensitivity of respiratory center to arterial PCO2. So this will leads to periodic hyperventilation. Then coughing and wheezing. Coughing and wheezing. Wheezing means there is a continuous whistle like sound during breathing. When you will breathe, there is continuous whistle like sound will produce. This condition is called as wheezing. This is because of there is a um, accumulation of cough, right, in our lungs. So this produce whistle like sound. Then fatigue and weakness. Fatigue and weakness. You may feel lethargic, right? You may feel lethargic. Then Abdominal symptoms like anorexia, nausea, abdominal pain. Anorexia means loss of appetite, and you may feel abdominal pain, right? These are the aortic stenosis and aortic regurgitation or orthopnea. These are the terms, right? We have already discussed in our etiological part. Here these symptoms are continue, as here it is written that continue. This include the symptoms or clinical manifestations. It further include chest pain due to angina and dyspnea. The person may feel chest pain due to angina and dyspnea, right? Dyspnea means shortness of breathing, which will develop the pain in chest. Then cardiac edema. Cardiac edema. Now, what is edema? There is fluid accumulation, right? Cardiac edema and pulmonary edema. Then hydrothorax and ascites. Now, what is ascites? There is transduction of fluid into pleural cavity. There is accumulation of fluid into pleural cavity. So, this condition is called as ascites. Then, congestive hepatomegaly. Congestive hepatomegaly or splenomegaly, right? There is maybe failure of hepato means liver, weakness of muscle of liver. Then splenomegaly, weakness of spleen, right? Then jaundice, it may produce jaundice and weight loss. The patient may show weight loss. So these are the symptoms by which one can identify that patient has congestive heart failure or congestive cardiac failure, right? So the very common symptoms are irregular heartbeat, shortness of breathing, right? Shortness of breathing, kinestoc breathing means periodic respiration, coughing and wheezing, fatigue and weakness, abdominal symptoms like anorexia, nausea, all this. Plus, there may be chest pain due to angina. Now, angina is a cardiovascular or coronary artery disease which will cause chest pain because of lack of oxygen carrying capacity. This angina will produce cardiac edema, hydrothorax, congestive hepatomegaly, jaundice, weight loss. These all are the symptoms of congestive heart failure, right? So, if we talk about congestive heart failure, then this we have to write, if the short note is asked like write a short note on congestive heart failure, then you have to include definition, etiology, pathophysiology, and clinical manifestations or sign and symptom. Now, hope you clear that congestive heart failure is disease which is associated with the dysfunctional ventricle, means there is a impairment of ability of ventricle to fill up or eject the blood, right? Or there is a weakness of heart muscle. And causes includes very common causes are coronary artery disease, high blood pressure, there may be defect in heart valve, there may be aortic stenosis, aortic regurgitation, or congenital heart defect. Some very less common causes includes viral infection, thyroid disorder, disorders of heart rhythm, several anemia, some medications also develop the heart failure, right? It includes painkillers, anti-diabetic, rosiglitazone and pioglitazone, and anti-cancer. And anti-cancer includes cyclophosphamide and 5-fluorouracil. Plus, alcohol consumption also develop congestive heart failure. And in pathophysiology, how the disease will progress. So it will start with initial myocardial injury, and this initial myocardial injury will produce due to the pressure overload, volume overload, and loss of function of myocardial tissue, right? This all cause decrease in myocardial contractility, and this cause systolic or diastolic dysfunction, and this cause reduction in stroke volume and cardiac output. So ultimately there is a less blood available in body, right? Because the ability of ventricle is impaired. The ventricle cannot pump out the blood properly, right? And this cause activation of compensatory mechanism. This includes activation of sympathetic nervous system, RAS system, and cardiac modification, right? And ultimately this all leads to congestive heart failure. Symptoms include shortness of breathing and fluid accumulation in lungs, kindness, stop breathing, coughing and wheezing, fatigue and weakness, abdominal symptoms like anorexia, right? Chest pain, cardiac edema. So, this all are the symptoms of CHF. And the medications which can be used, how we will treat, it's not in your syllabus, but it's just for information that congestive heart failure is treated by various class of drugs like beta blockers, then calcium channel blockers, and the most first line drug is cardiac glycoside. Cardiac glycoside, which may be in your pharmacognosy syllabus, it is herbal product, and this cardiac glycoside has a major effect in treating congestive heart failure. The name of drug include digoxin and digitoxin, right? Digoxin and digitoxin. Plus, other than this, it includes mm, beta blockers, propranolol, metoprolol, labetalol, right? Calcium channel blockers, AC inhibitors. AC inhibitors means the drugs which block the pathway of RAS system, renin angiotensin system. So ultimately there is no any production of angiotensin, and there is no further any secretion of aldosterone, and there is no any retention of sodium and water, right? So it will ultimately there is less load on the cardiac tissue, right? So this is all about congestive cardiac failure or congestive heart failure. The question may be asked in any form, either congestive cardiac failure or congestive heart failure or only heart failure, right?